All you do is say 1, 2, 3, and on 3 you get
The traditional route that we train advanced clinical practitioners is very much from the university perspective, a master's in advanced clinical practice, which is generally driven by academic regulations. There's a dissertation.
I think there's an element of the unknown around apprenticeships. I know when I think of apprentices, I think of when I left school and people went into kind of apprenticeships from leaving school, and I never really considered a postgraduate apprenticeship as a thing that was possible.
because that's what you examine.
We've been very lucky at the University of Nottingham in that we've always been very much involved in the curriculum development but also in the delivery. With the apprenticeship side of things, that's given us a little bit more control, and it's also allowed us as an employer and us as a system from Nottinghamshire to discuss what we would like to see within our curriculum so it meets the needs of our region. The traditional route for training an advanced clinical practitioner here at Nottingham University Hospitals is that we would apply for funding on a yearly basis, going through a process of scoping where we need ACPs. Something which I've always found very difficult is not knowing how many we would get funding for, so meaning we can't appoint to positions by the time that we would then be able to get people actually on the course.
This is day 1 of examination.
A real advantage with the ACP apprenticeship is that we pay a large amount of money into the levy, and it then means we can access that funding. So really it gives me a little bit of control about the funding every year.
Hello there.
Traditionally, people view apprentices very much from the 16 to 19-year-old category. For advanced clinical practice, the occupational standard is at master's level, and the people who are accessing the advanced clinical practice practitioner apprenticeship are very senior, experienced staff.
I work in the emergency department at the Queen's Medical Centre. My first day of actually joining the department, we were introduced to the whole team, including the advanced clinical practitioners who work there.
And just hold there for me.
It's just something that immediately appealed to me and where I wanted to go within my career.
So that's power.
We were initially made aware of the apprenticeship through our employer, so through James, who suggested that this might be a route that would be good, particularly for the emergency department and acute medicine, because they'd already got well-established teams of advanced practitioners.
Thanks both for meeting today. This is your second tripartite?
Yeah, second. Yeah.
Cool. So I'm just going to look through your learning log for...
A real advantage of the apprenticeship is around the tripartite interviews, knowing about learning logs, knowing where our trainees are, and actually having this agreement between the university, us as the employer, and the apprentice. We have this equal agreement which allows us then to develop a ACP which suits their needs, okay, and suits our needs as an employer, and there's also good partnership with the university as well. The master's programme here is also led by a consultant, Frank Coffey.
From a University of Nottingham perspective, we very much co-produced our curriculum with the employer to make sure that what we were producing was wanted by them. In our traditional programme, we had a 60 credit dissertation and a 20 credit work-based learning module. And from an employer perspective, whilst a traditional dissertation obviously addresses the research pillar, it's quite a substantial piece of work and often isn't as beneficial for what was the traditional student. What we've switched to now is we've now got a 60 credit work-based learning portfolio. It does still address all those research aims that we would have in a traditional research dissertation and that we would need for an ACP pillar.
Obviously, as an employer, I'm keen that our advanced clinical practitioners at point of graduation are clinically competent, and we have a nice shared agreement about how that's done, how that's academically accredited, rather than having to run separate governance structures within Nottingham University Hospitals, for example. So we have a really good relationship that the portfolio work-based learning aspect of the apprenticeship programme makes up the majority of the credits, but mapped to that is not only core competencies, but we also have our specialist competencies for the individual ACPs within that area. The assessment process at the end is a joint assessment process between us as employers, the clinical leads of the ACP teams, which is often a consultant, and then Dr. Coffey would also be there as well, representing the university to ensure that the competence of our advanced clinical practitioners is at the level we want at point of graduation.
So we're going to do it in the thumbs.
We are 6-7 months now into the apprenticeship. And it's been a good experience. It's allowed a much closer relationship for the employer the student and the university to kind of all collaborate together. It is a challenge, and there's no kind of getting around that. There needs to be hard work put in, both within the clinical environment of your day-to-day work and also academically as well.
The biggest advice I would give other institutions considering this is really look at the detail once your programme's written and look at how you manage the process of the initial needs assessment and managing the learning logs and the tripartite reviews.
Let's just say normal reflexes. You could say with it, if you want, you say spinal root, C7, C8.
For me,
5,
it
6,
would
7, 8.
seem that this is the appropriate use of our levy is to actually access that more for our advanced clinical practitioner trainees for next year, and actually say as a cohort, as long as the specialities can support the curriculum, we would take the majority, if not all of them, on an advanced clinical practitioner apprenticeship pathway.